Thank you, Rena, so much. And, I am not a cardiologist. I am a family physician, and I see women at all ages, from adolescence to midlife and into menopause, and even into women in their 70s and 80s. And so when I think about heart health, it's really something that we need to think about throughout our health and lifespan. And it is not something that is often discussed in your healthcare appointments with your healthcare provider, because we're generally trying to focus on new ongoing symptoms that you may present with, or prescription refill. And so the discussion around heart health sort of becomes embedded or hidden amongst all the other things that you talk about with your family doctor. So what I love about this topic today is that I can help you navigate your own healthcare needs based on where you are in your life, whether that's pre-pregnancy, postpartum, midlife, or in menopause, and what you need to know about your heart health in that stage of your life. So why is it that we are talking about this today, and what do you need to know? So next slide, please. So the first thing is that 2/3 of all heart disease and stroke research has always been focused on men. And so a lot of the information that is publicized or that you learn about is actually based on men's health research. Women were not even included in any form of research until the late 1990s. That's only 25 to 30 years ago. And the reason why is because there was this thought that because we have all these fluctuating hormones as women, there was really never a baseline. And so trying to understand our health was just too complicated, and we were sort of left under the radar. And so this means that a lot of the information that we know about is based on men's health and not women's health. The other thing you want to also keep in mind is that as women, we worry a lot about cancer risk, and particularly breast cancer. But what we don't realize is actually the first and number one killer of women in Canada is heart attack, stroke, and heart disease. And that's very, very important to understand, because some of these conditions are sort of gone without being on the radar. And oftentimes you don't have symptoms of heart disease or symptoms of high blood pressure or symptoms of hyperlipidemia or high cholesterol until you actually get screened. And so as a family doctor, what I love about my job is I have the opportunity to help women with prevention, not just treatment of symptoms, but about prevention of long-term health risks, including cardiovascular disease, stroke, and heart disease.